Welcome to The Usual Suspects. Gary and Steve are not with us today. I wouldn't let them be with us today because this show is about something so important. I'm joking. The show's important, but Gary and Steve couldn't be with us today. And, you know, we often talk about politics and just a sense of politics on this show, but every now and then, and Gary likes to talk about this and make sure we have shows that talk about our community here in the capital city. And today we're going to talk about Bond Community Health Center. And if you don't know about Bond Community Health Center, that's all right. Just stay tuned, because after this show, you're going to know all that you can ever know about Bond Community Health Center and all the great things that they're doing, and you'll learn, you know, some of the challenges as well. I got a couple guests here today that's going to help me do that. None other than the CEO of the Bond Community Health Center, Dr. Temple O. Robinson. Thank you for being with us today. And also a good friend of yours who's helping you with this 35th anniversary that y'all are celebrating, Mr. Jamie Van Pelt, president of ESPMedia. So thanks for having both of you on the show today. I know that we have in Tallahassee a lot of health providers, and but you are in the community, and now you're celebrating 35 years of being in the community. Tell for the people who don't know, tell us a little bit about where Bond is and what Bond does, what you have been doing for 35 years.
Well, it sounds like a commercial, but we have a center or a site near you, wherever you are. Bond is a comprehensive community health center. So what that means is you can get primary care and OB, prenatal care. You can get dental services, podiatry services, chiropractic services, a pharmacist, all in one place. We provide things that you may not get at a usual doctor's office, a community doctor's office, those things such as case managers to help you understand where you're going and help navigate certain things. Transportation services, so someone to actually come to your house, pick you up, and bring you home. Or someone to go to the pharmacy, pick up your medicines, and take your medicines to you. You know, we have providers still making house calls. So it's, when I say it's comprehensive, it's comprehensive.
Yeah, and that's a lot of because of the clientele that you have, that you were created for, right?
Exactly.
And I think, so in this 35-year anniversary, you're not just letting that pass by. I mean, you went to somebody like a Jamie Van Pelt to help you sort of educate the community about not just where you've been, but where you're going. When you talk about the 35 years and you've been CEO, I remember reading, and I'm sure a lot of our viewers remember reading when you came on as the CEO. It wasn't like all happy-go-lucky over there.
I mean, it wasn't.
And you came in with some challenges, and I know financial challenges were a big part of it. Many years in the red that you were challenged with trying to rectify that. How's that going?
Well, it's going much better. We still have a very, very thin margin, but it's going much better. Going back to the 35 years, though, I just want to take a moment because a lot of people don't realize that Bond was started almost in a room the size of a closet in a community center, a gymnasium center, to help folk get to see a doctor. It didn't matter if you had insurance or didn't have insurance. There were no doctors on the south side of Tallahassee to care for folk. So we started there and had ups and downs and challenges, and now we have 4 sites across the city. We have a mobile unit.
That's amazing.
We're partnering with the medical school. We're partnering with the School of Pharmacy at FAMU. We're partnering with the University of Florida in a lot of their research. So to come from that and not celebrate what was started and those great ideas that those heroes, those founders, framers, as they say, that seed idea, and now to come 35 years, it is a big deal.
We were going into, you know, your decision to come into what looked like a sinking ship. I mean, when you lost federal funding and I mean, when you were challenged with losing federal funding, I mean, that was really that was going to make it or break it, right? Doors open, doors shut.
That's correct.
But you came anyway.
Yes, well, should I say I stayed anyway?
You stayed anyway.
But when we lost that federal recognition, that federal deeming, that's the legs of what we call an FQHC, a federally qualified health center. And we had it for 20 plus years. So when that was lost, an ugly domino effect then took on. You had bond losses, federal funding. So now the county, who's good stewards of our taxpayer money, saying, wait a minute, we're not going to throw good, hard-earned taxpayer money behind bond. So then we lost a significant portion of county funding. Then the state said, wait a minute, if the county's not putting up money,
I know where this is
if the
going.
county's not putting up money, we're not going to worry about trying to draw down money from the federal government to help bond or to match money from the county. So then we lost a significant amount of county state funding.
Sure. Mm-hmm.
Then you went to try to write a grant, and they said, well, are you an FQHC? No. Do you have the backing? Can you get letters of support from your community stakeholders? No. And so you were just out there. So you went from being flush to being in the red, $3 to $4 million.
Right. How did you recover from that? Because you have. And let me say that. And Jamie, you know
Yes,
this.
yes.
You have recovered, and now it almost like that didn't exist.
Right.
And that's got to be leadership.
Yes.
But it also echoes the fact that there's a need,
Yes.
and you're providing a service
Yes.
that was necessary for you to succeed.
Well, there were a lot of things. There were still people in the community who knew the staff that was still working in bond. Not just me, but other staff members who knew that they had faith in us. They knew we were going to work hard. They knew that we were in it to win it, if you will. Then, and I don't want to give a lecture on what to do on a sinking ship, but you have to make some hard decisions.
Right. Sure.
So we brought the entire staff, it was probably about 80 people. We brought them into a meeting, and I said, okay, I'm the CEO, and we're going to do what the Vikings did. And they said, what are you talking about? When the Vikings took over something, once they hit the land, they burnt the ships, okay? And they said, you either here to stay to fight it out, because there's no turning back. We burnt the boats.
Okay.
So
Wow.
we had this meeting, and then we all took a deep breath, and we said, we're not firing anybody. We're not laying anybody off. We're all going to take a 10% cut or a 10% cut in our hours. But this is our community health center. You had people who slaved and worked and toiled 35 years ago to get this thing going, to help people. We had 10, 12,000 patients who needed Bond's help.
Back with our final few minutes with Jamie Van Pelt and Dr. Robinson of the Bond Community Health Center. And guys, tell us, how can people help?
Well, I'm going to go first.
Yeah, please.
Okay.
We talked about the various funding sources, but what is really dear to us is the funding that we receive from Leon County, so therefore taxpayers. And I'm going to ask you, if you're a taxpayer, come to one of our facilities, see what we do. Come and experience Bond Community Health Center. We're a great investment. You'll sleep well at night when you realize that this is where your money is going. So we have a site at 1720 South Gadsden Street. We have a site on the corner of Palm and Monroe, mostly pediatrics. We have a cooking school there, chiropractor. We have a small site in the CarePoint building. Remember, they had a lot of brouhaha about CarePoint.
That's right.
But we have a site in there called Bond on Magnolia. We have a site off Pensacola, the K. Freeman Health Center, and you've probably seen our pink mobile unit around town doing things. But I need to thank our partners in this community. Community partners, the medical school, the pharmacy school at FAMU, the University of Florida, city stakeholders and city and county leaders. And anyone who loves Bond, friends of Bond, thank you so much. We couldn't have done this without the community lifting us up.
Well, thank you for your leadership. And Jamie, what's next in the 35th celebration? What's coming up?
November 1.
November 1.
The weekend of the Miami game. Also Florida, Georgia for our
Well, we might need to bring some hurricanes over there
That'll be fine.
that weekend.
That'll be fine.
Yeah,
That'll be
it'll
fine.
be at Mission St. Louis,
Yes.
and all the information's on the website and on social media. So we want everybody to come out and enjoy themselves, and most importantly, support this entity that's supporting us in our neighborhoods.